The recent tragic death of a 7-year-old girl from a peanut allergy has called into question the school's responsibility when it comes to children and allergies. So for parents of allergic kids, what can you do to help protect your child when they're at school? Well, joining us to discuss this is family practitioner and author of the blog yes5.net is Dr. Karen Latimer. Dr. Latimer, thanks for being with us today. This case is so heartbreaking. What happened?
Well, this is a tragedy of monumental proportions, and truly I think it probably could have been avoided, which just makes me so incredibly sad. But this little girl has known food allergies, known severe food allergies. She was at school, another child gave her something, likely, and we don't know, with probably a peanut product in it because of the severity of her reaction, and she went into anaphylaxis shock and died. And
at 7 years old. And what were some of the symptoms that either she displayed or other people that if they have a nut or a shellfish allergy have?
Right, so I don't know exactly what she displayed, but my guess would be sort of what would be typical. Initially some mild symptoms like maybe a runny nose, itchiness, rash, some hives, some GI upset. People often will have diarrhea first, and then often very quickly it can worsen rapidly and start having shortness of breath, wheezing, decrease in blood pressure, and decrease in the heart rate.
So there's a lot of question right now, and there's a lot of discussion that's going on in schools and parents and communities all across the country about the responsibility of schools to carry something called an EpiPen. What is an EpiPen?
An EpiPen is basically an injection that carries a pre-measured dose of epinephrine, which in the case of an anaphylactic reaction is life-saving. It needs to be injected, so I know people are a little fearful of that, but it will save a life if somebody has it on board and actually uses it.
Is it difficult to use?
No, it's simple. I actually have one if you want to see.
Yeah, I mean, I'd like to see it because I think, like you said, a lot of people would be hesitant, especially when you're caring for someone else's child. It's one thing if you were to give them, something for a headache or they have an upset stomach. It's another thing when you're starting to inject a child. Right,
but you also have to remember that you're only doing this in the instance of a severe reaction.
Okay.
So you are in that situation where you're thinking CPR, you're thinking 911. It's an emergency situation, and I have to believe that any school nurse or any school administrator should know how to do this and would be able to do it in that instance.
Simple to use?
It's so simple to use. I mean, really, truly idiot-proof. This is an actual EpiPen, and it comes only in 2 doses, EpiPen Junior or EpiPen, which would be for adults. So it's not dose-specific to a child. 2 doses only. So a child would always get this dose. This is the actual pen itself. This is a training pen.
Okay.
So here, take this. I'm going to remove the safety cap.
All right.
Just grab it with your fist.
Right here?
Yep.
Okay. I'm actually going to give you one?
You were going to jam that into my leg hard and hold it for 10 seconds. Hard. Yep. 10 seconds.
And that's
what you have to do. That's delivering the medication, and that would save my life if I were in fact having an allergic reaction.
So something so simple like this could be used. And one of the other things is that, people are wondering what are some of the tips that parents can have when they can talk with their school administrators, their nurses or something like that at the school to have this kind of conversation to say, yes, please inject my child if something like this happens.
Right. Well, I mean, that's the parent's responsibility. I mean, first and foremost, to make sure that their child knows not to, if the child has known food allergies, not to eat food that other children give them. Obviously, educate the child, most important. But then the caregivers, the school staff, they all need to know that this child has allergies and they need to have the medication available. That meant this is not helping a child at school if this medication is sitting in your drawer at home. It's only helping if it's at the school. And it's not going to help if it's expired. So it's important for parents to stay up to date with the expiration dates of the medications, to make sure that their child, if they're going somewhere where people don't know them, wear an allergy bracelet, an allergy alert bracelet. But most importantly, that people who are near that child have this medication and know how to use it.
Some potentially life-saving tips right there.
Life-saving tips, and I think every school, frankly, should have these anyway. And I hope and pray that that school did not have an EpiPen sitting in a drawer somewhere, because it would be like looking at a drowning child and not throwing them a life preserver because the life preserver belonged to somebody else.
Sparking a lot of discussion, some great information. I apologize if I gave you any kind of a bruise or
I'm going to have a huge hematoma on my leg, and I will be suing. And this is the reason that people are afraid to act, because they're so afraid to get sued.
But again,
no, it's fine. It doesn't hurt.
If it can be saving a life, obviously well worth it.
You would think.
All right. Dr. Latimer, thank you so much for being with us.